It can be frightening to witness an unusual breathing pattern in a loved one, and one of the most distinct is something we call Cheney-Stokes respiration. This isn't a disease itself, but rather a sign, a signal from the body that something else is going on. Imagine the breath like a wave. In Cheney-Stokes, the waves are irregular. The breathing starts very shallow, gradually gets deeper and faster, reaches a peak, and then slowly becomes shallow again. This cycle is often followed by a brief pause where breathing stops completely, a condition known as apnea, before the entire pattern repeats itself. It's a rhythmic, cyclical pattern of breathing that stands out from the normal, steady rhythm we are all used to. The name might sound complex, but the concept is simpler when you break it down. Think of it as the body's control center for breathing, located in the brain, having a communication problem. The brain isn't getting the right signals about the levels of oxygen and carbon dioxide in the blood. As a result, it overcorrects. It tells the body to breathe rapidly to get more oxygen, but then it senses too much oxygen and not enough carbon dioxide, so it signals a slowdown or even a complete stop. This delay in communication creates the characteristic waxing and waning pattern. It is an outward symptom of an internal struggle for balance. This pattern is most often noticed when a person is sleeping. A family member might observe their loved one's chest rising and falling in this unusual crescendo-decrescendo rhythm, punctuated by unsettling moments of silence. While it can be alarming to see, understanding what it is can help demystify the experience and guide you toward the right actions. It's important to remember that Cheney-Stokes respiration is a clue, pointing doctors toward an underlying medical condition that needs attention. It is not the problem itself, but a very clear symptom that should never be ignored by caregivers or family members who happen to notice it. Observing this pattern is the first step. The cycle of deep breathing followed by a pause can last anywhere from 30 seconds to 2 minutes before it starts all over again. The person experiencing it is often unaware, especially if it happens during sleep. That's why the keen eye of a caregiver or family member is so crucial. Documenting what you see, how long the cycles last, how frequent the pauses are, can provide invaluable information for a healthcare professional. This simple act of observation can be the key that unlocks a proper diagnosis and leads to a more effective treatment plan for the underlying issue at hand. So, what causes the body's breathing regulator to go haywire? The most common culprit is congestive heart failure. When the heart isn't pumping blood efficiently, it causes a delay in how quickly the brain receives information about blood gas levels. This circulatory lag time is a primary driver of the overcorrection pattern we see in Cheney-Stokes respiration. Essentially, the brain is reacting to old news, creating a cycle of frantic breathing followed by a pause. It's a classic example of how interconnected our body's systems are, with a problem in the heart manifesting as a problem in breathing. Beyond heart failure, another significant cause is a stroke or other forms of brain injury. The brainstem is our body's command center for automatic functions like breathing. If this area is damaged by a stroke, a tumor, or a traumatic injury, its ability to regulate breathing smoothly can be severely compromised. Kidney failure can also lead to Cheney-Stokes respiration, as failing kidneys disrupt the blood's chemical balance, which in turn affects the brain's respiratory signals. In some cases, it can also be seen in people who are nearing the end of their lives, as part of the natural process of the body's systems slowing down and shutting down. The primary symptom is, of course, the breathing pattern itself, but other signs may accompany it, pointing to the underlying cause. If congestive heart failure is the issue, you might also notice swelling in the legs and ankles, shortness of breath during light activity, a persistent cough, or extreme fatigue. These symptoms are all related to the heart's inability to circulate blood effectively throughout the body. Recognizing this cluster of symptoms alongside the unusual breathing can help a doctor pinpoint the diagnosis much more quickly, allowing treatment to begin without unnecessary delay. If a neurological issue like a stroke is the cause, the symptoms will look different. You might observe sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, confusion, or a severe headache. These are all urgent signs that require immediate medical attention. The Cheney-Stokes breathing in this context is just one piece of a much larger and more critical puzzle. It's a reminder that the body often sends multiple signals when something is wrong. And it's up to us and our medical teams to listen carefully to all of them to understand the full story of what is happening internally. While we can't directly prevent Cheney-Stokes respiration itself, we can focus on preventing and managing the underlying conditions that cause it. This brings us back to the fundamentals of good health. A heart-healthy lifestyle is your best defense against congestive heart failure. This means eating a balanced diet that is low in sodium, saturated fats, and cholesterol. Fill your plate with fruits, vegetables, whole grains, and lean proteins. Regular physical activity, as approved by your doctor, strengthens the heart muscle and improves circulation, making the entire cardiovascular system more resilient and efficient in its daily work. Managing chronic conditions is another cornerstone of prevention. If you have high blood pressure, diabetes, or high cholesterol, it is absolutely essential to follow your doctor's treatment plan. This includes taking your prescribed medications consistently, monitoring your levels at home, and attending all your follow-up appointments. Uncontrolled high blood pressure is a leading cause of both heart failure and stroke, two of the primary triggers for Cheney-Stokes respiration. By keeping these conditions in check, you are not just managing a number on a chart. You are actively protecting your brain and heart from damage that could lead to serious complications. If a loved one is already experiencing Cheney-Stokes respiration, there are some simple home care strategies that can provide comfort and support. One of the most effective things you can do is to elevate the head of the bed. Using extra pillows or an adjustable bed frame to prop the person up can help ease the work of breathing and may reduce the severity of the apneic spells. This simple adjustment in sleeping posture can make a significant difference in their comfort throughout the night. It helps gravity assist with lung function and can lessen fluid congestion that might be contributing to the issue. Another helpful home remedy involves a machine called a CPAP, or continuous positive airway pressure. While often associated with obstructive sleep apnea, a CPAP or a more advanced BiPAP machine can sometimes be prescribed by a doctor to help manage Cheney-Stokes respiration. These devices provide a steady stream of air that keeps the airways open and promotes more regular breathing, overriding the body's faulty signals. This is not a do-it-yourself remedy. It must be prescribed and calibrated by a healthcare professional. However, it is a common and effective at-home treatment that can dramatically improve sleep quality and overall stability. It is absolutely critical to know when to seek professional medical help. If you notice the Cheney-Stokes breathing pattern for the first time in yourself or a loved one, you should make an appointment with a doctor. Do not dismiss it as just snoring or a strange quirk. It is a significant clinical sign that warrants a full medical evaluation to uncover the root cause. Be prepared to describe the pattern in detail. When it happens, how long the cycles last, and any other symptoms you have observed. This information will be vital for your doctor to make an accurate diagnosis and start the appropriate treatment. There are certain situations where you should seek immediate emergency medical care. If the unusual breathing is accompanied by chest pain, severe shortness of breath, confusion, bluish lips or skin, a sign of low oxygen called cyanosis, or symptoms of a stroke like facial drooping or weakness on one side, call your local emergency services without delay. These are red flag symptoms indicating a life-threatening event that requires urgent intervention. In these moments, time is of the essence, and waiting to see a doctor is not a safe option. Prompt action can save a life and reduce the risk of long-term disability. For those managing a chronic condition that causes Cheney-Stokes, regular follow-up with your doctor is key. Your treatment plan may need to be adjusted over time as your condition changes. These appointments are an opportunity to discuss how you are feeling, whether the home remedies are helping, and if any new symptoms have appeared. Consistent medical oversight ensures that your treatment remains effective and that any potential complications are caught early. Never hesitate to call your doctor's office if you have concerns between scheduled visits. Being proactive is always the best approach to managing long-term health issues. Ultimately, taking charge of your health is a powerful act. While conditions like heart failure and stroke can be daunting, there is much we can do through lifestyle choices and diligent medical care to manage them. Simple steps at home, from eating well to elevating your head at night, can make a real difference in your day-to-day comfort and well-being. By staying informed, paying attention to your body's signals, and working closely with your healthcare team, you can navigate these challenges effectively. Your health is your greatest asset, and every positive step you take is an investment in a better, healthier future for yourself.